question another doctor to say, oh, why is this patient's levels are too high? Or even a patient to question you, say my levels are too high. It's only, you have to put it in context, and it's only based on the time in which you took it. So if you realize the time that you took it, that yes, that was my peak, then you label it as a peak. If that's my trough,
Right.
it's a trough. It doesn't mean, so even if your trough comes down to where you started, it doesn't mean you were that way in the beginning of that dose. And that's something a lot of patients need to get their head around, because they'll say, my levels are this. Well, those levels are dynamic. They're not static.
Exactly.
So your level was this at this point in time. And I think a lot of people have a hard time getting their head around that.
Well, and I'm glad you brought that up, because that's a factor that I don't hear anybody talk about that. Literally, I've never heard anybody bring that up or talk about that. And that's such a good and valid point. And that's why a place like yours is such a big deal, that you have that kind of information. Now, let me ask you this. Well, I have two questions for you, but let's start with this one. For you, and like we said earlier, the question of, well, how much should I take for TRT? Well, I don't know. What do you find? Because I'm sure it's just like when I do a video and I'm talking about steroid cycles, for example, and I say, hey, this is a standard dose, but that doesn't mean that's the dose for you. What do you tend to run into that you find to be more of a typical dosage? Because what I tell people is, and I want to know if you agree with this, but this is what I've always found formula-wise. And generally speaking, your testosterone level will reflect about 5 to 7 times what you're dosing. So if you're dosing 100 milligrams of testosterone per week, I would expect you to be in the 500 to 700 range, closer to 700, unless you're not metabolizing well and you have a severe case of hypogonadism. Do you find that formula to be accurate? And what do you tend to see? If you had to say what your average TRT dose is it like 125? Is it 150? What do you find your average to be amongst all of your clients?
I think you got to look at different factors. For some patients, if they have a low SHBG level, they're going to excrete out a lot. So giving them a massive amount in one go is not going to be appropriate for that patient.
Right.
And it's funny because what people do, I'll see them write on it. We've got a forum as well, a Facebook group. And what people write on the Facebook group is like, I'm doing 100 milligrams a week, but I'm doing, 25 milligrams, or 20, so much per day. Or so wait, I got that wrong. Let's say I'm doing 100 milligrams, 125 milligrams a week, but I'm injecting 3 times a week, or I'm injecting 4 times a week. How much are you injecting? Oh, I split it up. Okay. But then so my point is, you're doing what you're doing. If you're injecting that, then you're doing that dose so many days a week, right? You're not doing the 100 milligram dose. So if let's say you're on a 4-day split, I'm doing 100 milligrams every 4 days, you're doing 100 milligrams every 4 days. If I'm doing 50 milligrams twice a week, you're doing 50 milligrams twice a week. But if they say that 50 milligrams twice a week, they might say on the forum or the Facebook group that I'm doing 100 milligrams a week.
Right.
So it's not helpful if people don't break down. I want to know the dose that you're doing. It doesn't matter how much you're getting in a week. What matters is what you are on the trough level. That's my point. Because it's going to go up, it's going to go down, and when it clears, you're going to do an injection again. So it really doesn't matter what you've done in total for the week. What matters is each injection period is what matters,
right?
And where you fall in the trough, because you're not going to do an injection, then another injection, then measure it at the end of the week.
No.
And I think a lot of people fall into that trap as well, not understanding. Because I think maybe from the bodybuilding community, you get so ingrained in what are you doing, per week, and
right.
I think it's kind of pointless. But you asked, what is our average dose, or what kind of doses do we do? And I'm saying it's bespoke TRT. We've got a dose for every different person. And at the pharmacy, we've got, we have access to many different types of testosterone. We've got testosterone propionate that comes, 25 milligrams per 1 mil.
Right.
We have the testosterone enanthate. And in the UK and in Europe, most of them come in, or all of them really, except for one, come inside ampules, glass breakable ampules. You have to break them open, which seems so archaic, but that's how they're made. Because they're made to be single use, which starts me off on a whole nother tangent where some patients see it as liquid gold, and our instructions from the doctor, and I know people are going to hate this, is, use the dose that you're prescribed and discard the rest. Because if you open this glass ampule, there's no rubber bung on it. It's open to the air. Yes, there's a preservative in it, but we can't guarantee the sterility once you've opened it. So if you're doing things and decanting it into something else, there's one thing for the compounding pharmacy to do that, because they've got, a whole, sterile laminar flow setup. It's all ISO rated. But it's another thing for a patient to do that on the kitchen table, is to start decanting something into a vial from the ampule. So that's always been really difficult. But we try to follow and take the high road when it comes to that. But because we have so many different options of testosterone, so I keep getting off at tangents, it can start all over the board. Now, we've done an audit on the various types of testosterone treatments. And I think one of the most common, one that seems to work as a starting point, and it's only as a starting point, is you don't want to give someone too much, too little. If they've got an average SHBG, many will, 100 or 125 milligrams of a medium-acting testosterone ester, every 5 to 7 days, depending on the patient, depending on the preference, depending on the cost of the patient. There's a whole combination of things, because we've seen it really work well for those patients on those doses. But if they have a low SHBG, the doctor will look at creams. They'll look at maybe the testosterone propionate. They'll look at testosterone cypionate, 50 milligrams twice a week or every 3 days. So there are so many different options. And I think that's where the coaches come in, and they help listen to what the patient's going to work, because you have to work out, okay, what's going to work for a patient's quality of life. Does that patient want to inject that frequently? And we've had some that buck the trend, because it's not always the hard and fast rule that, if my SHBG is low, I can only do daily injections. No, we've got some patients that say, look, I don't care. I hate needles. I hate injecting, but I don't want creams either, or gels. So I just want to do it once a week and forget it. And so do it once a week. I mean, years ago, that's all most people ever got. And that was considered microdosing.
Right.
And then other people can't feel quite right on weekly dosing. So they may need something more frequent, but smaller. So yeah, I don't have a one hard and fast answer.
Sure.
Traditionally, about 125 milligrams every 5 to 7 days, or 100 milligrams every 5 to 7 days of a testosterone ester was okay. But we've moved so far beyond that to having all these different options. It's been really, really good. And we also have the option in the UK. We end up importing the multi-dose vial testosterone cypionate, which allows for smaller, more frequent dosing in a safer way compared to, I think there's some other clinics. You talk about some of the US clinics. There's some UK copycat clinics that either don't understand or not too concerned.
Right.
That they'll, have the patients just give them the ampules, tell them to break it and decant it into something.
Shit.
And, because those aren't really licensed for patients to use normally on their own. They're usually meant for healthcare professional, for like a vaccine dose or something like this.
Right.
And so we've always taken the high ground, and we even got confirmation from the Royal Pharmaceutical Council that the right way to do it for the ampules is one ampule, one dose. So
right. Yeah. I mean,
that's the right thing to do.
That's typically the right way to do it, but you know how it is.